I'd now like to welcome Dr. David Kwak or Kwak Young-hwan from the International Healthcare Center at Soonchunhyang University Hospital here in Seoul. Good morning.
Good morning.
Great to have you in the studio once again. I just wanted to start off first by asking what the atmosphere is like at the hospital. And we've seen those number of daily infections go down quite drastically over the past couple of weeks. We've also heard of hospitals scaling back their designated sort of rooms or facilities for COVID-19 patients. So what is the atmosphere like among your colleagues and at the hospital?
We are definitely seeing a great decrease in numbers of visitors. As you've mentioned, we are also planning to sort of scale down the screening facilities that are outside. We're trying to manage so that it'll transition from screening everybody outside
Right.
to sort of screening only a number of people and then possibly bringing them in. Well, not exactly screening them inside, but we feel much more safe that now that the number of people are decreasing.
Right. And you have seen those numbers drop, even those coming in for tests as well.
I'm actually seeing half of those that are visiting now.
Very good news. Let's just knock on wood and hope those numbers stay down.
I hope so.
Meanwhile, we have seen a lot of news about possible treatments and also vaccines. One of them, of course, came out from China, which has been ahead of the curve in the number of infections, of course, and recoveries, and also, it seems, in the development for a vaccine. There was a mention of an adenovirus vector vaccine, which was given to more than 500 volunteers, and we're waiting the results of that. But this is rather new, and a lot of new words there: adenovirus and vector. We know vaccines, but those three words put together, it's very sort of new and it's very foreign to us. So could you sort of explain what that is and what we should be looking out for?
Yes. So the adenovirus is one of the viruses that we usually get infected with, just like any other virus, rhinoviruses, adenoviruses, influenza virus. Those are very common viruses that cause flu-like symptoms in human. But adenovirus, out of many other viruses, was also studied very well to the point where people could manipulate it and sort of manipulate their DNA system to carry other viruses information on them. So this particular adenovirus that we're talking about here is not actually a viral factor. It's more of a shuttle bus type of a deal here, where we put other viruses information on top of this virus to be injected into a person's body so that we could see our expected results from there.
And that's where the vector comes in. So
Yes.
it's not just an adenovirus vaccine, but the vector is kind of where it acts as a shuttle bus for this COVID-19, a little bit of the COVID-19 or the coronavirus to be shuttled into our bodies.
Exactly. Vector is a terminology that is used for DNA materials in viruses.
All right. How promising do these experiments and testing seem to be? And we know that China is definitely ahead of the curve, right? They've now entered, the second sort of trial?
So this particular study that we're talking about is going into their second phase of the clinical trials. And we've talked about this a few weeks back. Usually each phases of clinical trials takes at least a few months to even few years. But China, having gone through all the pandemic beforehand, they are in an advanced situation where
Right.
they could go ahead and study all these and put out all the results. But it also seems like we still need to be careful about their results because its timing also matters. We need to take a certain amount of time to see all the possibilities of possible side effects and possible outcomes of it. So having seen China hasten their processes in not only phase one of the trials, but also going into phase two, I'm being more careful as to what can possibly come out unexpectedly.
And we are seeing news of that too, because there had been drugs that have been touted by various world leaders or various media as being very promising. We talked about a couple of them here as well. One of them is this chloroquine, and then its kind of byproduct or a related product, hydroxychloroquine. They were quoted, or they were kind of hailed as being very effective in curing COVID-19. But there was a recent report by the FDA that suggested very serious side effects. So tell us about that and how serious those side effects are. And does that mean that maybe they cannot be a viable cure or treatment?
I would see, well, let me start off with saying this. Hydroxychloroquine and chloroquines are still viable methods because we don't have much other.
Okay.
So let me begin by saying that. But these drugs were originally used for as antimalarials, but not only those, they were also used in people with autoimmune diseases. That's because they showed in prior studies, previous studies, that they were very virus specific in their effects, but they also showed some immune modifying mechanisms in their workings inside the human body. But the side effects that we need to mention is quite crucial in this because the studies that probably was done in the U.S. showed a lot of severe side effects that happen to people, more particularly in regards to arrhythmia.
Right.
That is a heart beating that's not beating regularly, which can also end up even as in a death of a people or a stoppage of heart beating. But that's not just the only one side effects that we actually expect from hydroxychloroquine. When used in people with autoimmune diseases, we first screen out people with their eye vision test and also with electrocardiogram because those are the two most commonly known side effects to the drugs. Eye vision problem I mentioned is because these drugs are also were studied to show macular degeneration, retina degradation, meaning they basically can make you go blind.
Wow.
In very rare cases. So we need to be careful in using these medications. And as I probably mentioned before, these drugs should only be given to people under a strict control of doctors.
Right.
They should not be ever taken just
liberally over the counter.
Exactly.
As we heard of some cases in the U.S., right? When initial news came out that chloroquine could be a potential cure, we saw some people just going out and doing that and suffering some of those severe consequences. I am also curious about the drug that we talked about before on the show, remdesivir. That was also quoted as being a possible cure. And then this past week, we heard some conflicting reports that I think even the WHO came out and said that it was not proven to be effective.
Right.
And then it kind of retracted that statement because it was on the WHO website and then it retracted it saying, oh, we didn't mean to actually put it out. And Gilead, who makes the drug, also refuted that as well. So confusing messages. What should we take from that?
Okay, so I'm going to make another personal statement here. I would say we need to wait until formal results come out of every study regarding the remdesivir. It has shown great potential because it showed, to my knowledge, it was about 68% of improvements in people that it was being used in. The failure of the study that happened in another country, to my knowledge, happened because of lack of volunteers.
I believe it was China.
Exactly.
And we mentioned that China is also pushing their own sort of vaccine trials, so there may be a political factor in there as well. Who knows?
Right, right. So I'm going to be a little hesitant to comment on the political issue.
Right.
But in the medical aspect, all being said, we basically have to wait until, because Gilead themselves did not come out with formal results even in the U.S. yet. It was only in the middle of the that they peaked to us the results. So we need to wait until the whole formal results come out.
Very good. Kind of related to vaccines or maybe treatment. On a lighter note, I guess, American actor Tom Hanks, who has served as kind of the face and maybe the voice, the very public face and voice of COVID-19, especially in the U.S. anyways, he announced that he's going to be donating his blood to help develop a vaccine. He recovered from it fully along with his wife. So is it related to the plasma treatment, or what does this donation of blood help medical authorities do?
Well, donating blood can actually also yield plasma so that can also be injected to other people as in a convalescent therapy. But the studying recovered people's blood will also help us in development vaccines against the virus, not just through the plasma therapy. First, looking inside the blood, it may possibly help us find the exact neutralizing antibodies. And we also may be able to find exact component of the virus that can be extracted to form vaccinations against. And it may show us different components of the blood either risen or reduced, which will give us an idea how the virus has worked inside the person. So basically, the blood of a recovered person shows us the aftermath of what virus has done to a person. So by studying those, we would be able to better prepare ourselves to how to treat people actually going into the infection and also possibly find some curative measures out of it.
Or a vaccine as well.
Or vaccine, yes.
Speaking of antibodies, we have heard of various countries around the world conducting sort of mass or small-scale antibody tests, and they're trying to figure out exactly, I guess, how many people may have been infected because there's such a large number of people who are asymptomatic, of course. Soonchunhyang, director of the KCDC, also declared that we will start antibody testing sometime in the future, in the near future, not exactly right now. What is the importance of antibody testing, and can it actually replace just widespread testing for the coronavirus as well?
So we have to think about the sensitivity and specificity, basically meaning the accuracy of the test. The antibody testing currently is believed to be less in its accuracy when measured against the RT-PCR, which we are currently using. But it is much faster. So in cases, because currently for people who have to be admitted to a hospital to receive, let's say, scheduled surgeries and et cetera, because we have to screen all of them out to be negative for COVID-19, we are currently making them be admitted a day earlier to be tested for COVID-19, wait a whole day, and then go on to their scheduled procedures. With this method, though, it'll give us much less time to test those things out. Meaning, if it was an emergency surgery case, it would only take an hour before we actually are sure that we can actually go ahead with the surgeries and whatnot. But it also serves a different purpose, meaning with the antibody testing, we are able to see if people were actually either exposed to the virus or even if they're currently going through the virus. Meaning, if we conduct a national survey with these antibody testing, we would probably be able to figure out what percentage of the whole population has been exposed and are immune to virus already. Meaning, if a result comes back with, let's say, 80-90%, we would feel much more confident to actually loosen up the restrictions we're currently having.
Because by that time, I guess it means that herd immunity has already naturally occurred.
Quite possibly.
So the antibody test would be conducted, I guess, simultaneously in tandem with just regular testing, and then we can receive that information.
Yes, but not as a diagnostic testing measure.
Lastly, your predictions about a second sort of wave coming in the fall or winter, I guess you would echo the advice of our authorities saying that we should prepare ourselves for another wave?
Yes, it's something we've learned from the history. The Spanish flu in 1918 killed the most people with its second wave and not with its first one. So that's something all the epidemiologists and all the doctors are scared of. We have to prepare ourselves for possible second wave at all times.
Not because of a mutation, you think, or is it because of a mutation that is more deadly?
Quite not possibly with mutation. It's more likely that it's the epidemiology factor, that it goes around the whole globe. And it takes certain time to actually come back to the country that it originated from.
Very good. Okay. Thank you very much once again, Dr. Kwak. I hope to see you again next week. That was Dr. David Kwak from the International Healthcare Center at Soonchunhyang University.